iCares project sought to build on the successes of past PEPFAR HIV interventions while ensuring that even more people living with HIV were tested, enrolled into care, and retained on treatment to ultimately achieve viral suppression. The laboratory program had a critical role to play in accomplishing this.
The laboratory interventions were so much more in the area of providing support to the treatment team to ensure that our clients are monitored for the improvement in their treatment. The laboratory is also able to support, of course, testing of clients to be able to get new people on treatment. There is something that was introduced in the last 2-3 years by the CDC, which is called a surge. Since we have the number of people that are already on treatment, we know that there is this gap that each state will have to fill. So the laboratory is very instrumental in this, especially in the testing, making sure that there are availability of testing materials from all the states to be able to meet up with the surge in some of these states. There is something we call viral load, which is what is used to monitor whether these clients are doing well on treatment. It actually quantify the amount of virus in this patient's blood. And of course, expectedly as you take treatment, it's expected to be coming down. So the laboratory is the one that does this testing, not just the testing, also report it so that the doctors can be able to utilize it for their treatment.
As the number of clients on treatment increased, APIN realized that a huge focus needed to be placed on improving the infrastructure and capacity of laboratories for prompt investigations and quality services.
Before now, government has done their own part, but in most of our facilities, you find out that the lab department is always a second thought in terms of infrastructure. But when APIN came, they went to the various facilities and discovered that the infrastructure of the laboratory needs to be improved upon. They went in to expand most of the laboratories. They renovated some, they expanded some, to provide the required space for laboratory services. They went into training of the personnel as well. They trained personnel in different aspects of laboratory for quality services. In fact, they provided so many modern equipments.
APIN too has equipped our labs. I'm proud to say that within this last grant year, APIN has replaced our viral load machine. We have a new viral load machine, different from the last. And APIN has continued to maintain and service those are the viral load machines and supply the kits for it, in addition to other equipment that APIN has given.
With funding from the U.S. Centers for Disease Control and Prevention, CDC, and the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, APIN supported 3 PCR laboratories under the iCares project. One of those labs is the Federal Medical Center McCarty's PCR laboratory.
With the support we received from management, we were able to set up the PCR laboratory in FMC McCarty to operate for 24 hours. Provision of adequate manpower, provision of diesels, incentivizing the various staffs to be able to run call duty, we put them on shift duty so that 24-hour service can be covered. And of course, we have special fund dedicated to manage faults. So as soon as we are having fault, there is somebody there to provide mitigation so that sample analysis is on a 24-hour basis. So the lab was positioned to have support from FCT because there are 2 mega labs here. It got to a time that Benue was not only analyzing all its samples, it was also receiving samples even from FCT and other states. just because we're able to set up a system and we ensure that the system works.
We are about the biggest site in Nigeria. In fact, we are the biggest site in Nigeria. We have over 10 to 11,000 patients that are currently on treatment. This is unprecedented and is a record. And because we run 24 hours, we shall also record an unprecedented success in terms of the volume of viral load, CD4, and other tests that we are doing in our lab. That will be a huge success to be celebrated. And as it's known, we also service other points in the whole Benue State, Nasarawa State, Taraba State, Kogi, and parts of the Federal Capital Territory.
APIN's support and contribution to laboratory services in its implementing states went far beyond providing equipment and consumables or strengthening the capacity of laboratory personnel. APIN also worked with relevant stakeholders at the facility, state, and national levels to strengthen laboratory processes and procedures.
APIN program, laboratory programs especially, has been very instrumental in the development of various tools that are now termed national tools. The National Laboratory Information System that is currently being used by the country, we have been very instrumental in providing lots of add-ons that have helped to improve the system. The innovations from within the APIN program, we are able to, for instance, if your sample is rejected in a particular laboratory at FMC Makurdi, we have been able to introduce a software into the LIMS system that can track the sample and inform you, send you messages that please contact so person because his samples will need to be recollected. Those are the kind of things that the program has introduced.
In Ondo and Ekiti states, where the turnaround time for samples was at an all-time high, APIN introduced remote sample logging, a strategy to address the challenge.
What informed this remote sample logging was that over the years, samples are collected from both hub sites and spoke sites, and these samples are accompanied to the PCR lab where the sample is being entered by data clerk. And as we continue to scale up the value testing for the program, we now notice that those kind of category of sample, when they get to the PCR lab, they spend a number of weeks before this sample has been entered into the LIMS of that PCR lab, making those samples to be accumulated, and they have a lot of backlog that need to a long turnaround time. So this actually was the issue that informed this remote sample logging, where the remote site or the facility will log in the sample by themselves and monitor the progress of that sample in terms of testing and result retrieval back to the site.
By strengthening the implementation of quality management systems in supported labs, APIN ensured that these labs met the requirements for accreditation by international bodies.
Apart from the fact that we set the pace in quality management system in the country, the first set of public health laboratory to get international accreditation in Nigeria was supported by APIN Public Health Initiatives. And right now, maybe I would not like to let the cat out of the bag, but we have 3 that will soon get international accreditation.
And now we started implementing laboratory quality management system. SLAMTA came in from CDC, and myself and my staff got involved in training and developing the laboratory quality management system, which culminated in the accreditation we got from South Africa Accreditation Body in 2017. I would say over time we have grown from being nothing to a well-established accredited ISO 15189 laboratory, one of the first teaching hospitals to be accredited in Nigeria.
APIN's support in strengthening laboratories through the PEPFAR-funded iCares project positioned these labs to undertake other initiatives and to respond effectively to the COVID-19 pandemic.
Among the top list in the equipment is the genetic analyzer, which is already installed. We had one before, but they have upgraded that to the software in it is a new one, and in addition to that, they have also supplied another genetic analyzer. So we have 2 genetic analyzers currently, and we've been designated as one of the sites that will do HIV drug-resistant testing.
And in this facility, we did upgrade of facilities, especially the GeneSpart testing platform. Usually, that was used for TB testing, but now had to be recalibrated to also test for COVID.
So we had the TB COVID, and COVID was an emergency that came suddenly. It was not planned, but still we had to take care of our patients. We provided them with testing, we provided them with immunization, we provided them with education. We also linked them to appropriate care to ensure that their outcomes are okay. This way, APIN continues to support the site. This is an ongoing process that we also appreciate.
APIN's laboratory program and its support to the labs in its project states have contributed significantly to the quality of HIV services delivered to people living with HIV in Nigeria, and to ensuring that Nigeria remains on track to achieve the UNAIDS 95-95-95 goals come 2030.
We probably would not be where we are today, and we remain eternally grateful for that. Like I mentioned before, we started from a very small lab, so we want to express our gratitude to APIN and CDC, Nigeria and PEPFAR program for the support, massive support we have received over time.